The START program is an online program targeted for interns who will be coming to Stanford for the residency training in 1 year's time. The program itself is an acronym. It stands for Successful Transition to Anesthesia Residency Training. We have videos, which are instructional videos that begin with a clinical vignette. I'm going to sync the sound. Okay, I'm checking my vaporizers. That all looks good. I'm going to turn the oxygen up to 100%. Just checking everything, checking my laryngoscope, making sure that looks okay. Good. We use a point of view camera, which is a special camera that attaches at eye level. The reason we chose that, we wanted to pull the residents in. We wanted them to really see what we see and have them really view these videos as a real life experience. I have to get my succinylcholine. All right, I'm gonna get ready to get started here.
Okay, great, you ready to go? I just took the surgeons to scrub their hands. 27-year-old penetrating trauma to the belly, hemodynamically unstable. They wanted an XLAP, so we need to do a STAT, our rapid sequence induction. You ready to go?
I am. Okay, I'm gonna go ahead and get started.
Okay, wait, stop. I don't want you to use propofol on this patient.
Oh, that's not the right drug?
No, look at the hemodynamics. He's hemodynamically unstable.
Okay. What should I use?
I think we should use etomidate. You have it?
I have it up in the back. I'll go get it real quick. In addition to that monthly video podcast, we also have a lecture that they view online as well. All of these interns, no matter where they are in the country, can interact with each other and learn together.
Finding time for reading about anesthesia during your internship year is very difficult because you have to read up about medicine.
It looks like you peed. Yeah?
So I found that the START program from that perspective gives you the must-need-to-know nuts and bolts about anesthesia. I've read a lot about induction agents, about maintenance anesthetics, about what to do in emergencies during the OR while you're doing procedures. And it's allowed me to think different from a medicine person. From that perspective, it's opened up my eyes as to where I'm going next year. I've got an idea of what I should know or understand or be aware about for day one of anesthesia.
We're gonna let you go home today.
Apart from the educational perspective, it also provides logistical information. For people who are not in the area, it provided information about where to hang out, where to eat, where to look for an apartment. Dr. June and Dr. Harrison gave a nice little teaching session on how to use the computers at Stanford. Because the programs, once you get to know them, they're amazingly helpful and they make your life a whole lot easier. But because they're so involved, the first couple of days can be very complicated and you need a lot of help.
And you're all set. You can go home.
Thank you.
All right, take care.
All right, thank you for your help.
You're welcome.
Having the START program going along with this whole year and having some kind of integration with Stanford was awesome. Kind of helped me feel like, well, okay, I'm not actually there this year, but they still are paying attention to us as the incoming CA1 class and want to help us kind of prepare a little bit so we don't feel so like fish out of water come July 1st. The START program definitely helped us kind of connect with my future CA1 colleagues, as well as some of the already existing anesthesia residents. I already found out that some of my incoming CA1s love soccer, and there's already plans to make barbecues to watch the World Cup when everybody gets here in July, and maybe start a co-ed soccer team. I think it's definitely pretty unique. They've really tried to integrate all of us early on and provide a great online resource. I mean, not only for us, I actually had some med students at this year, Stanford medical students who are interested in anesthesia, who are doing their internal medicine rotations, who have watched the videos on the START website. Even they think it's super exciting and helpful and kind of get to learn a little bit more of anesthesia in that respect.
Just got paged.
Oh, great. Sorry to bring you back from breakfast. They got into a lot of bleeding. Here, Jim, how is it going?
It's a lot of bleeding, but I don't know where it's coming from. We're still looking.
So the first month especially, but actually the first 6 months of anesthesia training has often been related to trying to take a sip of water off a fire hose. The START program was primarily created to help alleviate some of those concerns. We give information about how the Stanford system works, how the computer systems work, obviously background on medical knowledge that they'll need to successfully transition from an intern to a Stanford anesthesia resident. It's always going to be disorienting starting a new program, and practicing a specialty that you've had no real prior training in. But this hopefully will allow them to kind of feel a little more comfortable because we've gone over some of the key points, focusing on what their day-to-day life is going to be, what they're expected to do, and how to approach their job from day one.
A lot of these programs tend to have orientation with some teaching on how to use a computer, etc. But it's all based on just papers and you have to read about it, as opposed to Dr. Chu's method, which is, let me show you how you actually do it on the computer. That really makes it a unique program. It reminds me that in a couple of weeks, I'll be going into anesthesia and doing the things that I want to do for the rest of my life.
A couple of the START modules at the very beginning of the year, you would talk about dosings for intubation drugs and what size of ET tubes you use. And so the couple times where I actually got to intubate a patient, I already knew the doses for the intubating medications. I knew which ones were appropriate for these patients. And I think, of course I had learned that at one point or another in med school, but that at this point was, a year and a half ago. So, I would not have remembered those other than had I not watched the videos from the START program.
Are you claustrophobic at all?
Not really.
Okay. Well, I'm going to just put it lightly on your face.
They've been helpful in the last 3 months as we're actually already starting to make the transition. So I'm excited. Can't wait to start.
So there's been some surprises along the way as we've been producing the START program. I think the biggest surprise is the fact that the interns actually don't feel it's a burden and don't feel it's a lot of work and actually enjoy being part of the program. It's something that reminds them every day why they're doing internship, because they want to become anesthesiologists, and it just keeps that motivation going, that energy going throughout the year that maintains their interest in our specialty. Hello there, Mr. Johnson. I'm
hi.
Dr. Chu. I'm going to be your anesthesiologist today.
Hi, Dr. Chu.
I'm just going to quick clean my hands with this alcohol sanitizer.
Okay.
And is it okay if I have a seat?
Yeah, please.
Okay.
Yeah.
Now, how are you doing today? You look a little nervous,
Yeah,
actually.
I'm a little nervous. Yeah.
Tell me what's going on. Why are you nervous?
Well, I've never had a general anesthetic before, and do sometimes people not wake up from? I've heard that, so I don't know if it went, but I've heard that you can go into a coma and never wake up from anesthesia.
It's totally understandable, and it's very common for people to have concerns about anesthesia. So let me just start by saying that anesthesia these days is really safe.